Hi, I'm Dr. Richard Lippman. I'm an endocrinologist, internist, and weight loss specialist practicing in Miami, Florida. I want to tell you about a new weight loss drug called Contrave. Contrave is the newest of the 3 drugs approved by the FDA. This drug is not actually a new drug, but a formulation of 2 older drugs. Each one causes minor amounts of weight loss, but when taken together cause significant weight loss and lack of cravings. It produces fullness as well. Contrave is FDA approved. It's been tested over 10 years. It controls hunger, eliminates cravings. Tests at over 4,000 people have shown it to be safe and effective. It causes rather rapid weight loss. Who is Contrave for? It's indicated with a reduced calorie diet for chronic weight management for only adult patients who have a body mass index of more than 30 or 27 with some complication due to obesity. The BMI is the weight divided by the height. You can calculate your BMI at the URL on the bottom of the slide. Contrave is made of 2 older FDA-approved drugs combined into one new drug. Bupropion is the first drug. The trade name is Wellbutrin and has been present since 1985. Bupropion increases dopamine and norepinephrine uptake in the brain. It results in control of depression, it stops compulsive behavior, it stops anxiety, and it's been used for smoking cessation. By itself, it causes very little weight loss. Naltrexone, or Riva, is the second drug. It's been present since 1994. It's classified as an opioid antagonist, and it's used for the treatment of drug addiction and alcohol dependence. Again, this drug has very little weight loss properties. However, when these 2 drugs are placed together, there's a remarkable weight loss and lack of cravings. No one is quite sure how this happens. Bupropion works in the front part of the brain, increasing messengers and chemicals, including norepinephrine and dopamine. This decreases appetite and decreases cravings. Naltrexone works in the middle of the brain, blocking the opioid receptors. These are scattered through the brain. This reduces appetite and controls cravings. Here's a slide showing a synapse where 2 nerve cells attach. Notice the dopamine is in the little red circles and the norepinephrine in the blue circles. It's produced in the cell and goes to a point where it is released from one cell to the next. The norepinephrine is attaching to a receptor in the second cell, and the dopamine to a dopamine receptor in the second cell. When this happens, it sends a message through all the cells to stop eating and stop cravings. This is how Contrave's dual component stops hunger, controls cravings, and produces fullness through the day. Hunger is depicted in the pink lines and is mirrored by episodes of fullness. Cravings occur anytime, but most in the late afternoon and evening. Bupropion suppresses appetite through the 24 hours, while naltrexone, extended release, stops hunger and cravings in the day, and especially cravings in the evening. The combination of the extended release bupropion and naltrexone suppress appetite and control cravings through the day. Each component works together on different parts of the brain. Here's the average weight loss with Contrave over 56 weeks of the study. Note, however, most of the weight loss occurred in the first 24 weeks. This is the change in body weight on the left and the weeks on the bottom. Here's a better way to look at the weight loss with Contrave. It's difficult to talk about average weight loss when patients and subjects weigh different amounts. So the typical way to do this is to talk about the percent of weight loss from the beginning of the study. More than 5% weight loss is considered good, while 10% is better and 15% is quite extraordinary for a drug. In the studies, you will see in the black bars the Contrave, and that 80% of the people that participated lost more than 5% of their body weight, 55% lost more than 10%, and 39.5% lost more than 15%. Taking a 200-pound person, a 10% weight loss would be 20 pounds, and a 15% weight loss would be 30 pounds. These were quite remarkable results. Contrave is contraindicated in patients with hypertension and seizure disorders. It cannot be used with people taking chronic opioids and MAO inhibitors, as well as people allergic to Contrave. Suicidal behavior and ideation has been noted with people taking Wellbutrin, but this was not seen in the studies with Contrave. Side effects of Contrave: 7% had headaches, 10% dizziness, 20% nausea, which is the most significant side effect, 3% insomnia, dry mouth was seen in 3%, and constipation in 10%. No other side effects were seen, typical of most appetite reducers such as insomnia, anxiety, and palpitations. In fact, Contrave is given at bedtime. Is Contrave for you? Well, consider Contrave if you have a BMI of more than 27 with medical problems or 30 without. Have you had difficulty losing weight despite multiple attempts? Do you have cravings, especially in the evening? Do you often hide food or eat in secret? Do you eat out of stress, depression, or boredom? Do you awaken in the night to eat? These are some of the behaviors where Contrave has been found to be very effective. It's also very effective in people with diabetes, hypertension, and cardiovascular disease who cannot take other medications for weight loss. Sleep apnea responds well to the drug as well. Contrave is given in a titrating dose over 4 weeks, starting with 1 tablet in the morning and weekly increasing the dose until the patient takes 2 tablets in the morning and 2 at night. You can read more about Contrave and download a short booklet from www.richardlittmanmd.com. If you need more information, please email me or contact my office. Thank you for your attention.